So my name is James Esty with the Grandview University Masters of Athletic Training program. This is my patient presentation for the class General Medical Conditions. So type 1 diabetics and tendon healing. So what is type 1 DM to start? So formerly called insulin-dependent diabetes. When you think of type 1 DM, think of insulin pumps, insulin injections. Traditionally, that is type 1 diabetics. So type 1 DM makes up about 10% of all diagnoses. The other 90% are type 2 diabetics. Usually patients will know they have this disorder before they turn 20. That's a fluid age. Some will find out later, some will find out much earlier, but usually in adolescence is when they find out they have type 1 DM. So what happens with type 1 DM is that the body is unable to adequately produce insulin or unable to produce insulin on its own. So insulin is produced in the pancreas, so which means the pancreas essentially stops working. So insulin is used to manage blood sugar and also manage carbohydrate use and storage. So from an athletic perspective, what that means is the athlete is no longer to efficiently use their carbohydrate stores when exercising, and then post-exercise, they're unable to efficiently restore those carbohydrate stores for recovery, and then for exercise on the next day, the day after that. So basically, during exercise, they're less efficient. They have basically smaller energy stores that they have access to at time of exercise. So getting into shape, running, like using those stores is going to be harder than an athlete who does not have type 1 DM, who has ready access to their carbohydrate stores. And then post-exercise, their recovery times are going to be slower because their body has trouble taking up new carbohydrates and then also like efficiently distributing glucose in the body to help muscles, tendons, etc. kind of repair and recover after exercise. So type 1 DM population and prevalence. So around 2 million Americans have type 1 DM. This includes about 300,000 children and adolescents. So most type 1 diabetics are within that 45 to 64 year range, although there are younger ones. As you see on the chart to the right of the screen, it lists them all out. Men and women share similar prevalence rates. Men are slightly more likely to have type 1 diabetes, but it's not significant. And then ethnicity-wise, people of African descent have the highest prevalence rate for type 1 diabetics. So, patient presentation. My patient is a 19-year-old white male football and track athlete. He triple jumps in track. It should be noted that because of his issues that we'll talk about here in just a second, he is no longer in football. So he's been dealing with chronic left patella tendon problems for the past 2.5 years. He's routinely gone through rehab protocols, but after clearing, symptoms always just come back. So in the instance we'll be talking about for this year, so in preseason, this patient reported a sharp pain in their left patella tendon during football practice, and then that pain just kind of stuck around. So we pulled him from practice. Initially, we went through a traditional eccentric patella tendon loading program, went through our plyometrics, got back to return to play. Almost immediately after starting return to play, the athlete had another patella tendon episode where he reported another sharp pain in that left patella tendon, and we had to pull him from practice again. So after the second episode, we essentially said, we're done with football, we're going to figure this thing out. So at the time of his injury, we don't have the exact number, we can't find it anywhere, but athlete's H1C number was over 7%. His target number is under 7%. Normally around that 6.5 to 6.9. That's important because once an athlete gets over their target range, in this case 7%, their injury rate their risk of injury goes up for the purpose that we expressed in the previous slide of that they just can't recover adequately after exercise due to their inability to basically process glucose throughout their body.